B.
A 35-year-old man presents to the emergency department after vomiting several times following an episode of heavy drinking. He is now vomiting blood. His vitals are stable and he denies abdominal pain or significant weight loss. On endoscopy, a longitudinal mucosal tear at the gastroesophageal junction is noted. What is the most likely diagnosis?
Okay, don't tell me.
Oh,
Now everybody should type your answers. And I'm sure everybody will know because I told you the topic we're going to do, right? Now, A, Boerhaave syndrome, B, Mallory-Weiss syndrome, C, peptic ulcer disease, and D, esophageal viruses. I think this one, everybody should know it. Everybody should know it. Everyone is going for B because I told you that's what we're going to do. But Doc, from what you read, what in the question caused you, Dr. Sabine, to go
yes.
for Mallory-Weiss there and not Boerhaave's?
First of all, here he is now vomiting blood, and the another thing is that endoscopy, a longitudinal mucosal tear at the gastroesophageal junction is noted.
Okay, so Dr. Sabine, again, what would have directed you to think about Boerhaave's instead of Mallory-Weiss?
Vomiting.
Vomiting and
Long
what else? No, what else? There's something in the question. Which should
Hammer sign or crunch sign.
what?
Patient would be unstable. He would be having crepitus, the hammer sign.
Because he's
Well, no.
stable
I'm
here.
just talking about what the question has stated. There's something the question has stated, and it should have stated it in a different way if it was Boerhaave's.
Longitudinal mucosal tear.
He
yes,
would be
Longitudinal
unstable.
mucosal
tear. Yeah.
Mucosal tear is more important
Mucosal.
here.
So now
Yes.
the question is this: you have to now start asking, okay, what makes Mallory-Weiss tear different from Boerhaave's? If Mallory-Weiss is longitudinal mucosal, what is Boerhaave's then? You realize that with Boerhaave's, it goes through both the mucosa, the muscle, and even the outer layer of the esophagus. And that is why in Boerhaave's, the patient is usually unstable, right? Because it is a transmural tear. Okay, so the answer is Mallory-Weiss tear. So Mallory-Weiss syndrome is characterized by longitudinal mucosal, this one, mucosal lacerations after forceful vomiting, often associated with alcohol use. Okay, now, so Boerhaave syndrome involves full thickness rupture of the esophagus and typically presents with chest pain. Why? Because the esophageal contents would have gone into the mediastinum, right? And that's very dangerous. Now, peptic ulcer disease usually presents with epigastric. And esophageal variceal disease, you realize that some way, somehow, me as your examiner or whoever will be examining you may be describing something which goes around liver disease. So that also tells you that before you sleep tonight, you need to know at least 20 stigmata of liver disease, chronic liver disease. Tell me 10 things that you will see on a patient with chronic liver disease: jaundice, parotid enlargement, scratch marks, if it's a male, gynecomastia, abdominal distension, that is ascites, hepatomegaly, testicular atrophy, pedal swelling, clubbing, palmar erythema. You should be able to boom, 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 like the way I'm talking about it. Right? Good. So if I was supposed to present upper GI bleed in relation to esophageal variceal bleed because of chronic liver disease, there would have been a way I would have presented the patient. Peptic ulcer disease, I might have told you that this patient has been taking NSAIDs, or this patient has been through tremendous stress, or the patient, might have done something which predisposes him to H. pylori infection, right? With Boerhaave's, I would have told you maybe the blood pressure is 60/40. The patient probably is becoming febrile. The patient has some crepitus as well, So that is it. Okay, next question. Who will read for this one for us, please? Who read this?
Can I read?
Please read.
A 50-year-old woman presents with the hematemesis after multiple episodes of reaching. She has a history of chronic alcohol use, but no known liver disease. Physical examination is unremarkable. What's the most appropriate next step in management?
Beautiful. Doctors, please type in your answers.
Immediate exploratory surgery, endoscopy to confirm the diagnosis, barium swallow obstruction, IV fluid.
Okay, so everybody's going for B. I've seen that Dr. Alepia is going for D. Okay, so what's the correct answer? The correct answer is B. The correct answer is B. Endoscopy is the gold standard for diagnosis of Mallory-Weiss syndrome and is necessary for visualization and possible therapeutic intervention. Because the Mallory-Weiss syndrome, yes, it can close on its own because of the longitudinal nature of the esophagus, right? But at times they may bleed for some time. Surgery is not indicated if there's no perforation. Number two, barium swallow is less useful. And the point about observation is observation without confirming the diagnosis could delay care because it could be that the patient has another cause of upper GI bleed and not Mallory-Weiss. Doctors, beautiful. Let's go to the next question. Next question.
25-year-old man presents with hematemesis after retching forcefully multiple times following a meal. He has no significant medical history, denies alcohol use, and is not on any medications. Endoscopy reveals mucosal laceration at the gastroesophageal junction. What is the most likely precipitating factor? A. Alcohol use. B. Hiatal hernia. C. Severe vomiting. D. Esophageal cancer. Do you want me to say the answer or just?
Haha, do you want to say the answer?
Yeah, I don't mind.
Okay, say the answer. Let's go.
I'm gonna go with C, severe vomiting, because
Severe vomiting. Sure. So severe vomiting is the typical classical precipitating factor for Mallory-Weiss syndrome. Okay. Alcohol use is a risk factor, but this patient denied it. So that is wrong, right? And hiatal hernia can contribute to it as well, but it was not mentioned. And as I teach, you realize that it may come up. And esophageal cancer is usually presents with dysphagia and weight loss. So that's another thing. So today, even though we are learning Mallory-Weiss syndrome, we also learn about Boerhaave. So we've learned something about peptic ulcer disease. We are learning how a patient with esophageal cancer will even present. And we are learning the risk factors for Mallory-Weiss syndrome.